Welcome to the show discussing problems and issues of health with Dr. Alcena. For this segment of the show, I'm going to continue to talk about COPD emphysema. COPD emphysema is a very common medical condition. Around the world, you have 600 million people who suffer from COPD emphysema. In the US, you have 12 million folks who have already been diagnosed with COPD emphysema. Another 12 million or so who believed to have it that are not yet diagnosed. So that would make it 24 million folks with the disease. It's a very, very bad situation. Last week, I went through all the different details on how people get these conditions. And also, you need to know that across the world, 27.4 million people die every year because of COPD emphysema. And in this country, 120,000 people die because of COPD emphysema. And one of the most common reasons why people develop COPD emphysema, of course, is tobacco smoking. And I misspoke last week when I said 48,000. It's 480,000 people. 480,000 people die every year because of the side effect of tobacco smoking. And altogether, 42.1 million people in this country are still smoking cigarettes. So it's a very, very bad situation. There are many, many other things that can cause COPD emphysema, but of course, on top of the list is cigarette. Now, last couple of days, yesterday in particular, there's been a lot of reports out there talking about the advantage of taking a baby aspirin every day. Now, I'm going to connect COPD, asthma, and baby aspirin to let you understand where there's a relationship here. Yes, the report stated that if one takes one baby aspirin every day, the incidence of esophagus cancer, cancer of the stomach, and cancer of the colon decrease markedly. But that is correct. Problem is that what they didn't say, the science is not new. Not at all. This is not new. This particular research is new. The report is new, but the science is not new. And the people who did the research don't have a monopoly on that science either. As a matter of fact, this book, African American, the Health Status of African American, and chapter 9, which is the chapter on cancer, page 206, you will find out the statement that I made about this very same issue, and I'll read it to you. The FDA, as I said here, has recently approved Celebrex. Celebrex is an NSAID, like when you go around, you see the Motrin, it's in the same family. Celebrex is a COX-2. That's the only one that's left on the market. And the COX-2 stands for cyclooxygenase 2. Cyclooxygenase is the enzyme that mediates all inflammatory processes in the human body, period. Okay, so now keep that in mind. Let me finish reading for you. The FDA has recently approved Celebrex to be used in people who have the propensity to develop polyps in their colon. Okay? And then I went on to say that the enzyme cyclooxygenase is needed to mediate inflammation inside the colon, and inflammation is a key component in the formation of colon polyps. So you see, this is already in this book, and this book is out several months, so the science is not new. And then, how did this happen? Well, it happens because cyclooxygenase is the enzyme that mediates all inflammation. So when you take an aspirin, which is a COX-1, Celebrex is a COX-2, aspirin is a COX-1, cyclooxygenase 1, it blocks the ability of the cyclooxygenase to begin the process of inflammation. To develop this type of cancer, it all starts with an inflammation, be it in the esophagus, be it in the stomach, or be it in the colon. In the colon, you can't form a polyp without the inflammation started first. You have to first have the reaction, an inflammatory reaction. From that inflammatory reaction, that's how you develop a polyp. So when you take the aspirin, aspirin is a fantastic medication, really incredible. In my mind, the best medication ever made, okay, because it has several components to it. Aspirin is an antipyretic. It could bring down fever. Aspirin is a painkiller, okay, and aspirin is an anti-inflammatory medication, okay. In this instance, it is the anti-inflammatory property of the aspirin that blocks the action of cyclooxygenase that then prevents the inflammation from beginning, hence decreasing the incidence of these cancers. Now, I listened to the news yesterday. I listened to them last night. But a single person who has an MD behind the name who were reporting these things were telling you what the facts are. You say, well, maybe they just didn't want to tell you. Not true. They just simply don't understand the science, and they don't know how to go into the details that I'm going into right now. And it is not new. This is something that's been around for several years. And I've talked about that before in my previous shows when I talk about colon cancer. So don't make it sound as though the science is new. It is fantastic, but it's not new. This is great research. Credit goes to them. But don't make it believe that this is new. I already wrote about it. A lot of other folks have written about it, okay? So now, how do we talk about aspirin and COPD and asthma? Well, let's get rid of the asthma component first. Many people who have asthma, a significant percentage of them, have a triad, which is nasal polyp. This is asthma, nasal polyp, and aspirin allergy. Let me repeat that. Significant percentage of individuals who have asthma suffer from a triad of condition: asthma, nasal polyps, and allergy to aspirin. Now, when I did the series on asthma, I didn't mention that, but I'm mentioning it to you right now because now we're talking about aspirin, which I'm sure is going to be in the news again sometime this evening. Well, that's why it's very dangerous to just take aspirin if you have asthma, because certain percentage of them, not only they're allergic to asthma, they also allergic to aspirin. They also, some of them are allergic to NSAID as well. So be careful. So that's the asthma part of it. The next thing is COPD, which is the topic that I'm discussing in this segment. There's a problem. People who have COPD emphysema have a high propensity of developing ulcer of the stomach because they over-secrete histamine, which then overstimulate acid production in the stomach, and then they develop ulcers. So you've got to be careful. So if you have asthma, if you have COPD, and then you have emphysema, you got to be very careful not to touch aspirin because it can cause you to bleed, because these folks have a propensity to develop ulcer. Now, I take a baby aspirin every day. It is a fantastic medication, but you got to know what you're talking about and what you're doing. Why? Well, the #1 bleeding disease in the world is a disease called Van Willebrand disease. And Van Willebrand disease is a qualitative platelet abnormality disease. 110 million people in the world have Van Willebrand disease. And Van Willebrand disease is the #1 bleeding disorder in the world. It's not hemophilia B, it's not hemophilia A, it is Van Willebrand. So how are you going to give people aspirin? People are going to take aspirin on their own when they don't know if they have Van Willebrand disease. 110 million folks across the world. 2.8 million people in this country have Van Willebrand disease. So they're going to start popping aspirin? Give me a break. They're going to bleed. And sometimes massively. And sometimes the bleeding occurs on the operating table because they don't screen people in this country as part of the protocol to see the platelets functions are proper before they operate on them. Which is not a good thing to do, because we do a prothrombing time, we do a partial thromboplastin time on everybody. We're sending it to the OR. If as though that's the rest of it, forget about it. I just finished telling you 2.8 million people in this country have Van Willebrand. Everybody who takes an aspirin, myself included, have man-made Van Willebrand, which means that your platelet is not aggregating properly to form a clot. That's the reason for taking it in the first place, for this particular reason. So that you protect your coronaries, so that you develop a clot inside the coronary to have a heart attack, blah, 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 blah. Even though that's not the only way people have a heart attack, but that's one of the major ways, okay? So, therefore then, let me tell you something else that's going to even be shocking to you. There's a condition called H. pylori. It's an infection of the stomach. It's a bacterium that resides in people's stomach. 50% of the world population, of the 7 billion people plus in the world, 3.5 billion of them are carrying the H. pylori in their stomach. and you can't, and they're not suitable to take aspirin. You say, well, how come? Well, here we go. The number one cause of bleeding ulcer in the world is H. pylori gastritis. Let me repeat that. The number one cause of bleeding ulcers in the world happens to be H. pylori infection of the stomach. 50%. In this country, 30% of folks in America are carrying the H. pylori in their stomach. 30% of the population. In New York City, 70% of the population are carrying H. pylori because people from all over the world, especially from the developing world, are crowding in New York City for one reason or another. So you're going to give these people aspirin? There's another reason why they shouldn't be taking aspirin if they have H. pylori. Because H. pylori itself can cause a condition called ITP, immune thrombocytopenic purpura, immune thrombocytopenic purpura. Significant percentage of people who have that. A couple of years ago, patient that I'm taking care of now wind up in New York City to have a prostate biopsy. Well, guess what? He wind up in shock receiving 6 units of blood. Okay? In shock receiving 6 units of blood in a hospital. Subsequent to that, he was sent to me to evaluate him for hematology evaluation. Guess what I diagnosed? H. pylori. Guess what I diagnosed after that? ITP. So that's why the man almost died. Because he had a prostate biopsy and he wasn't screened before it, which is not the protocol. No, that's not the standard of practice as far as I know. And I know very well the standard of practice of medicine in this country is not part of it. It's not the standard of practice either to check somebody's platelet function before you take them to the OR. And these people are bleeding left and right. And they're coming with all kinds of excuses why they bled because, oh my goodness, the prothrombin time was okay, the PTT was okay. But it just wasn't enough. The screening wasn't thorough enough. If you had done a simple bleeding time on the tip of the finger of this individual, you would have found that it was prolonged. Why don't you include that as part of your pre-op protocol? Well, I don't have that kind of power. When I'm sending my patient to the OR, oh yeah, that's when I'm in control. That's when I'm in charge. I do what I think is best for this patient to protect them. People showed up in the emergency room with all sorts of problems, headache, stroke, bleeding, whatever. They're in pain. They give them Toradol. Toradol is a very good medication, but guess what it is? It's an NSAID. Guess what it's going to do to the platelet? Make them malfunction, causing the patient to bleed even more. And you can't make this thing up. I'm not criticizing it. I'm not telling you any secret. This is what's going on. People show up in the ER, they get a shot-up injection of Toradol. It's good for the pain, with no thought being given to what the Toradol is. It's an NSAID, an anti-inflammatory medication that is used acutely to relieve pain. But the patient, if they have a bleeding issue because the platelet is malfunctioning, you're going to start bleeding right there. And I've seen it. One of my patients went for colon cancer surgery at a hospital that I will not name. The next thing I know, he was in shock in the recovery room on what was going on. He got Toradol intraoperatively. Can you imagine that? And the man almost lost his life. And I had to rush to the hospital, rush on the highway, risking my own life getting there to put him, stop the bleeding by giving him desmopressin to turn off the effect of the Toradol. To this day, this gentleman is so kind, he's so grateful. He lives in Florida, he retired, he's cured from cancer. When he had the cancer, he was 30 years old. Now, some 35 years later, he's still sending me Christmas card and calling me every now and again to check on me to see how I'm doing, because I saved his life, not because I removed his cancer, even though I subsequently gave him chemotherapy to treat the cancer of the colon, but what I gave him that saved his life was that I gave him desmopressin to stop his bleeding, because he was bleeding profusely and in shock. People are just not thinking, they're just doing things. You can't just do things for the sake of doing it. You really have to think the process through before you do it. You can't just negligently do things. You have to think. The brain is placed over the shoulder for a reason, to allow you to think. And if you can't think, then ask someone else to help you think the process rather than doing things that's going to potentially harm a patient. So for all these reasons, as important, as great a medication as aspirin is, you can't just go and take it on your own. You got to make sure you discuss it with a doctor. Go to your doctor, a healthcare person who really understands medicine, not just the basic. You really have to understand thoroughly to comprehend what I'm telling you so that you don't get hurt. Aspirin is fantastic, but look at all the conditions that I mentioned to you. Billions of people can get hurt by it, as great a medication as it is, because they're not suitable for it. That's why doctors take histories from patients so that they know what's going on. You know what to do, you know what not to do. A tremendous amount of women who are having excessive menstrual bleeding, breakthrough bleeding. In fact, von Willebrand disease is more common in women than men. And then what do they do? What does the GYN doctors do? They give them a hormonal, they give them an injection. Provera, I think they call it, whatever, or they put them on birth control pill. What do you think the birth control pill help? It helps because it increases the von Willebrand factor 8 level. That's why it doesn't solve the problem, but decreases the menstrual flow. Unknown to the GYN doctor that's doing it is because birth control pill increases factor 8 von Willebrand level. That little increase is enough to ameliorate the situation so that you put a Band-Aid on it temporarily. But these people, 15% of women who are complaining of fibroids, who have all sorts of stuff, 15%, and it's in this book, have von Willebrand disease. 15% of these women. And it will never be solved until this diagnosis is made and appropriate medication is given to them. And if they're being taken to the OR, they're going to be even more. It happened a couple of years ago. In fact, I have a patient going to have an operation next week who had similar problem, GYN problem. Now she's going to surgery for something else, but now I diagnosed her with von Willebrand disease several years ago. Now she doesn't let any doctor touch her unless she tells you, I got von Willebrand disease. She walks around with a little puffer. You could use it nasally as well, and so on and so forth. So I now have to prep her before I can send her to surgery. I mean, come on. I don't have a monopoly to this thing, to this knowledge. They're all there. People have just simply take the time and read the stuff, read the literature before you go and do things to people. And I'm not going to apologize for being such an advocate for patients. I've been a patient 3 times. Each time I had to diagnose myself. Each time I had to intervene in my treatment. The last time I almost lost my life. And I'm not going to get any more detail than that, because the folks that I erroneously brought into my care didn't know what the heck they were doing. I had to take over the management of my own health problem to solve it so that I can be here today talking to you. Now that's disgusting. This is the United States of America. We have all this knowledge. And I had to intervene 3 separate times to make my own diagnosis. I was misdiagnosed. Each time I had to correct that. And each time I had to intervene to provide my own treatment. Right here in the middle of the United States. Come on. Now, if this is going on, what is happening to other patients out there? Suppose I was not a doctor. Suppose I didn't have the knowledge. What was going to happen to me? I would have lost my life several years ago, unnecessarily. And I'm not here criticizing doctors. You have a bunch of doctors out there doing a fantastic job, working very hard. It's a very hard job, very complicated job. Sometimes it's very thankless. And I praise them. But those who screwed up, I'm going to expose what they did wrong as well so that they can cut it out. Just this week, I reported somebody who provided lousy care for my patient in an emergency room. I did, because I can't tolerate nonsense like that. That's not quality care, that's garbage. And I did it, and I'm continue to do it, because if I don't, the same nonsense is, I have a conscience. I can't go to sleep at night If I know that something bad happened, I know of it and then intervene to try to correct it. I have to, and that's who I am, and I'm not going to apologize for it. Okay? So, COPD emphysema then. Now that I finished telling you about aspirin, and believe me, there are many, many more conditions that I wouldn't even trouble you with, that people are walking around with, and they should not take aspirin because of it, even though aspirin is a fantastic medication, great medication. I prescribe it for my patients all the time, and I take it myself. But you have got to know who you're giving it to, what are the underlying conditions the patient may or may not have, so the aspirin may not be appropriate for them. I see people having a heart attack in the emergency room. Everybody rush, take 2 aspirin. Why 2 aspirin? Why are you giving 2 aspirin? Don't understand the 2 aspirin they're pushing to the patient acutely can cause more damage than harm. You give 81 milligrams. That's all you need. You can't take 2 325 milligram aspirin and push it on somebody to chew and swallow. They haven't thinking you're helping them. You're not helping them, because the more aspirin you give them, you're not allowing the native vasodilator to do its work to open up the vessel. Sure, you could prevent the clot, but you also have to open the vessel. And prostacyclin is being secreted by the wall of the vessel. Too much aspirin blocks that. Blocks that. So therefore, you're stopping the clot, but the vessel is remain closed because you didn't allow it to open, because you didn't allow the secretion of prostacyclin to take place by itself, because you give too much aspirin. Now, do you have to be a rocket science to figure that out? Do you have to be a genius to figure that out? Come on, give me a break. The people who make Agrenox figured it out. Agrenox has a vasodilator to dilate the vessel and the brain. It has 45 milligrams of aspirin. That's intelligent medicine. Whoever put that together has a brain. They were thinking the right way. They put 45 milligrams in each pill, and 200 milligrams was the vasodilator. So if they put too much aspirin in it, it would have interfered with the vasodilatory part of the medication. So that's somebody that you give credit to that was thinking properly. What upset me more than anything else is the lack of thinking processes that goes into decision making. I was a victim of it. My mother was victimized by it. That's because of that, she died when I was 7, giving birth. Because some doctor showed up 12 hours later, she exsanguinated to death and died in shock. That's how I lost my mother. Okay? So that's my beef, and that's why I'm such a patient advocate. And please, I'm not looking for patients. Don't call my office. You're not going to get an answer, because I'm here by myself now. I don't have a secretary anymore. I don't need no one. So I'm not looking for business. I have enough to keep me busy. Okay? So in any event, COPD is a bad disease. It damages. That's when the cigarette smoking or whatever the other processes that were involved damages the substance of the brain. So air cannot be transferred through and out of the brain properly. So therefore the person is gasping for air. In addition to that, the damage that has occurred to the different tubes that goes down the lung, the bronchioles, disposes the person to infection, predisposes the person to infection. And the infection further compromises the ability of the lung to function properly. And these people are prone to infection because, as I mentioned last week, all the cilia with little hairy thing that grew from the wall of these things have been destroyed because of the heat from the tobacco, from the pipe, from the cigar, or from the cigarette. So therefore, the inside is all naked, completely naked, ready to be blasted with viruses, bacteria, or fungi, or what have you. Okay, and these people get very sick. They cannot exchange air easily, so therefore they get very sick, and they can't breathe. Okay, they become very cyanotic. They need oxygen. They need oxygen. And what you have to understand is that when people have COPD emphysema, you have to measure very carefully the amount of oxygen they get. How come? Well, because the base of the brain, brainstem, is where the breathing center is located. If you give somebody too much oxygen who already have COPD, you're suppressing because they need to exhale the carbon dioxide so that they don't choke to death from it. Well, it's a very sensitive part of the brain. Too much oxygen suppresses that sensitivity part of it that you could trigger breathing. The first breath we ever we took when we were just born, trigger on that center. And that center is very sensitive. If you put too much oxygen, and shut it down. So that's why they have different ways of giving people the oxygen. If you give people nasal oxygen who have emphysema, COPD, that's not going to be helpful to them because you might harm them because you can't measure it properly. That's why we come something called venti-mask. We use the venti-mask because we can measure exactly what we're giving, and too little, too high, we could monitor it that way. But nasal oxygen, even though you could do 2 liters, liter and a half, you really cannot measure it properly. You think you are, but you're not. And you could suppress the sensitive center of the base of the brain, and the person can stop breathing. Important though oxygen is, too much of it can cause the person to go into respiratory failure. How about that? So physicians are trained and know exactly to be very careful when you're treating patients with oxygen, because that's what they need. They also need bronchodilators. They also need prednisone. Sometimes you may have to give them a little bit of IV fluid if they're dry, etc. And they may need antibiotics, either by mouth or intravenously, etc. So this is how you're going to manage the patient, keeping in mind that the steroid that you're giving them is going to take 6 hours to kick in. So meanwhile, you're depending on the bronchodilators to keep the patient alive, and if the patient cannot be managed successfully with all these things, the patient may have to be intubated so that you could breathe for them while they're on the respirator, and then so on and so forth. Next week, I will conclude the series on COPD emphysema. Until such time, keep watching the show. This is Dr. Alcena saying so long and bye-bye.